complex medicine ambassador and naturopath. We are here at the 2024 NHAA Herbal Medicine Summit, and with us we have the incredible and very popular Rhiannon Hardingham. Welcome, Rhiannon.
Thanks for having me, Emma. Always so exciting to be at the summit and, of course, to speak to you.
Excellent. Now, you've been speaking here this weekend. What was your talk on, and any key topics that you're really passionate about at the moment?
Predominantly, of course, being a herbal medicine conference, I brought it back to my stalwart of herbs and hormones, but brought in some I think topical conversations about how we assess risk-benefit when we're talking about herbal medicine use in pregnancy. Of course, we have to be super cautious, and of course, we know from an ethical perspective we're unable to test many products in pregnancy, but at the same time, with our higher risk populations, we know that there are some really effective interventions where any potential theoretical harm is really heavily outweighed by the risk for those who otherwise are at risk for other complications in their pregnancy. So that was really the main focus of my presentation.
Excellent, because it's such a fine line in clinical practice, and I feel like the collaborative angle, you've really got to work with her care team to get this sort of done in a way that's considered ethical and proper, isn't it?
Exactly, and I did speak a little bit about that, of course, about how we really need to be tapping into the research that is there and using what we can from that to support our practice decisions and to openly communicate with our patients' medical care providers so that everyone's on the same page. And often I find, as I'm sure you do too, clinically with these very complex patients, often their medical doctors are quite happy for our input if the prognosis is already poor. They're often like, well, let's do everything that we can. And, again, as I'm sure you see this as well, a lot of my patients have much better outcomes than were expected for them. And that classic comment, of course, that the placenta looks so big and healthy, and which is actually a medical marker of a healthy pregnancy. So some of these things are having really beneficial impacts for otherwise high-risk patients.
It's so good to have more in our toolkit for these cases. I just think it's incredibly profound, the difference that we can make. Because that comment around the placenta is absolutely one that rings true.
The placenta is everything. I'm so completely obsessed with the placenta. Sounds weird, but it's true. But I'm thinking about my patient's placenta from before the time they conceive all the way through their pregnancy. They're not thinking about it. They don't even know that I'm thinking about it. But from the moment they conceive, I'm thinking about what your placenta is going to be doing at 36 weeks, and we are manipulating that now. And for some patients, that means we're going to use some herbs, and there's going to be maybe some questions about that, but I'm really confident that the benefit of these herbs is really going to help your third trimester outcomes, and that's really what it's all about.
Excellent. So for the people that are watching and they want to know more about this, where can they find you?
My website is rhreproductivehealth.com. We are, of course, a clinic, but also a practitioner education platform. Currently, we're running a pregnancy masterclass, conveniently, but as you know, we have education and mentoring on all things hormones and fertility.
Excellent. Well, I can vouch for myself personally. I have mentored with Rhiannon and found it incredibly helpful from a clinical basis. Thank you so much for joining us today. Don't forget to head to the website, check out all the information we have there, and follow us on our socials.